Hi, I'm Ian Hickey from the Brain and Mind Research Institute. As you know, we've been working with GetUp on this mental health campaign for this budget. We're here outside Treasury where we've just received the fabulous news that the government will spend over $2.2 billion over the next 5 years on mental health. That's a fabulous result. Even more important than the size of the spend is the decisions that have been made about key investments. Over $500 million will go into early intervention services for children and young people. That means over 70,000 young Australians will now get services who previously missed out. Over $700 million will go into coordinating services for those with severe and persisting illness. That's those people who've really been neglected in the past by Commonwealth and state governments. That's a fabulous decision. Additionally, we'll see new investments in mental health research, e-health and new accountability mechanisms. These are all great decisions and it's a great result. Here's the story of the campaign.
Suicide is one of the biggest killers of Australians, particularly for those aged under 45. Mental health problems are the biggest cause of disability for all Australians. But just a year ago, none of the major parties had a serious policy on mental health. Mental health received just 7% of national healthcare funding, although it accounts for about 14% of the total healthcare burden. Advocates like Pat and myself have been working in this health area for decades, but in 2010, on the back of real community support, Pat was named Australian of the Year. We knew this gave us a great opportunity to convince politicians to tackle the mental health crisis. But the problem with mental health has always been one of silence. We knew we needed a loud campaign, a real movement of people, to make a significant difference. So Pat asked GetUp members for help. GetUp members responded by creating a huge petition and chipping in donations to put Pat's message on TV. The target, of course, was the government, particularly the Cabinet and the Prime Minister who was leading the health reform process. They hadn't heard much about mental health. We needed them to hear about it from every direction. So in addition to the TV ad, GetUp members contacted politicians, jamming their fax machines, phone operators at Parliament House, contacting their local offices. Throughout the election, mental health was really on the agenda in GetUp's town hall meetings, door-knocking drives in marginal electorates, and on election day, 1.7 million scorecards were distributed to Australians across the country. They allowed people to know where the parties really stood on mental health. In local communities across the country, there were candlelight vigils, first in Melbourne and then in over 50 towns across the country, creating real national media coverage. We all know if there's no media coverage, there's no serious interest in the issue. But as experts continued their conversations with government, they were dismayed at the result. My close friend and colleague and the principal advisor to the government on mental health, John Mendoza, resigned in protest and joined the GetUp campaign. His email to GetUp members caused the national petition to rocket to over 100,000 Australians, one of the biggest in GetUp's history. GetUp members even donated to put the petition in newspaper ads to make sure it landed on the desk of every politician. And of course, all of this created media coverage for the campaign. That's really what advocates like Pat and I need to have any serious impact on the decision makers. So in just 1 year, we moved from a position of relative silence about mental health to one of real community voice. We now had the government listening, hearing about the issue from every possible direction and from real people in their electorates and in their communities. They knew the community pressure was high and it wasn't going to go away. It had a voice through GetUp's campaign. When the Coalition and the Greens both updated their mental health policies and GetUp commissioned national polls, they showed that there was a huge number of votes to be won or lost. This forced the government into real action. What was left for Pat and Simon and I was to run around Parliament House in endless negotiations with the government come budget time. We knew if they really cared and if the Prime Minister was seriously committed, they had to deliver real money in this budget. I've seen Simon carrying the GetUp petition from the Minister's office to the Treasurer, to the Prime Minister's office, to the Assistant Treasurer's office, back to the Minister's office, then to the Prime Minister again, then to the Shadow Minister, to the Greens spokesperson, and then back to the Minister again. Of course, industry groups all have their own lobbyists, and in health, we've got plenty. But this time, that's where you came in. Real lobbyists for the people who've not previously had a voice, and on behalf of the community that is so affected by mental health problems. It's because of this movement and the action that you've taken individually and collectively, from putting your name to a petition, to tweeting about the campaign, organising mental health vigils, getting in touch with your MPs, personally donating to support a huge advertising campaign, that we now have the best funding result for mental health in our nation's history.
There's no doubt here in Canberra that this has been a genuine community-based campaign. Congratulations and well done.